Good day, everyone. I am Jonna Laulau, and for the next few minutes, I'm going to be talking about dehydration, its treatment, causes, effects, and symptoms. Before anything else, I'm going to leave you with a food for thought to ponder on for the rest of the discussion. So the question is, did you know that 75% of the body's weight is due to H2O? At the end of this discussion, you should be able to define the context of dehydration, discuss the causes, signs and symptoms, and treatment for dehydration, and enumerate the ways to prevent dehydration. To start, what is dehydration? Dehydration is a condition that can occur when the loss of body fluids, mostly water, exceeds the amount that is taken in. With dehydration, more water is moving out of individual cells and then out of the body than the amount of water that is taken in through drinking. Medically, dehydration usually means a person has lost enough fluid so that the body begins to lose its ability to function normally and then begins to produce symptoms related to the fluid loss. Although infants and children are at highest risk for dehydration, many adults and especially the elderly have significant risk factors. People and animals lose water every day in the form of water vapor in the breath we exhale and as water in our sweat, urine, and stool. Along with water, we also lose small amounts of salts or electrolytes. Our bodies are constantly readjusting the balance between water and salt or electrolyte losses with fluid intake. When we lose too much water, our bodies may become out of balance or dehydrated. Many conditions may cause rapid and continued fluid losses and lead to dehydration, such as fever, heat exposure, too much exercise or work-related activity, vomiting, diarrhea, and increased urination due to infection, diseases such as diabetes. Patients with diabetes mellitus show a definite polyuria, which is a condition in which the amount of urine excreted is much greater than normal, because glucose is a diuretic or tends to increase the excretion of urine. Excessive water loss during diabetes mellitus can lead to dehydration. We also have the inability to seek appropriate water and food, such as an infant or a disabled person. An impaired ability to drink, as in someone in a coma or on a respirator, or a sick infant who cannot suck on a bottle. And then, no access to safe drinking water, and significant injuries to skin, such as burns or mouth sores, severe skin diseases or infections, wherein water is lost through the damaged skin. In addition to drinking water, the body also needs replacement of electrolytes, for example, potassium and sodium, lost with the above-mentioned conditions. So drinking water without electrolyte replacement may not complete the balance of water and electrolytes the body has lost. Some symptoms may remain if this balance is not restored. The signs and symptoms of dehydration in adults range from minor to severe. Most doctors divide dehydration into 3 stages: mild, moderate, and severe. Mild and often even moderate dehydration can be reversed or put back in balance by oral intake of fluids that contain electrolytes or salts that are lost during activity. If unrecognized and untreated, some instances of moderate and severe dehydration can lead to death. Mild to moderate dehydration may include the following: increased thirst, dry mouth, tired or sleepy, decreased urine output, urine is low volume and more yellowish than normal, headache, dry skin, dizziness, and few or no tears. These symptoms may quickly worsen and indicate severe dehydration, with signs and symptoms developing. Severe dehydration may include the following: severely decreased urine output or no urine output. The urine, if any, produced is concentrated in a deep yellow or amber color. Dizziness or lightheadedness that does not allow the person to stand or walk normally. Blood pressure drops when the person tries to stand after lying down, also known as low blood pressure or orthostatic hypotension. Rapid heart rate, fever, poor skin elasticity, wherein the skin slowly sinks back to its normal position when pinched, lethargy, confusion or coma, seizure, and shock. The doctor may perform a variety of simple tests at the time of examination or send blood or urine samples to the laboratory. Through tests and examination, the doctor will try to identify the underlying cause or causes that led to the dehydration. First, we have vital signs. Fever, increased heart rate, decreased blood pressure, and faster breathing are signs of potential dehydration and other illnesses. Taking the pulse and blood pressure while the person is lying down and then after standing up for 1 minute can help determine the degree of dehydration. Normally, when a person has been lying down and then stands up, there is a small drop in blood pressure for a few seconds. The heart rate speeds up and the blood pressure returns to normal. However, when there is not enough fluid in the blood because of dehydration, the heart rate speeds up. Not enough blood is supplied to the brain. The brain senses this condition. The heart beats faster, and if the person is dehydrated, they often feel dizzy and faint after standing up. Next is urinalysis. The color and clarity of urine, specific gravity, or the mass of urine when compared with that of equal amounts of distilled water, and the presence of ketones, which are carbon compounds, a sign that the body is dehydrated, in the urine may all help to indicate the degree of dehydration. Increased glucose in the urine may lead to a diagnosis of diabetes or indicate loss of diabetic control and a cause for the dehydration. Excessive protein may signal kidney problems. Signs of infections or other diseases such as liver disease may also be found. Lastly, blood chemistries. The amount of salts or electrolytes such as sodium, potassium, and bicarbonate, and glucose as well as indicators of kidney function, such as BUN and creatinine, may be important to evaluate the degree of dehydration and possible causes. A complete blood count or CBC may be ordered if the doctor thinks an underlying infection is causing the dehydration. Other blood tests such as liver function tests may be indicated to find causes of the symptoms. Dehydration treatment options for adults include home remedies like sipping on water, drinking sports drinks that replace lost nutrients, cooling the body, and removing any excess clothing from the person. Medical treatment for dehydration in adults includes hospitalization and replacement of fluids lost. For home remedies, encourage people who are dehydrated, even those who have been vomiting, to take in fluids by sipping small amounts of water and drinking carbohydrate or electrolyte-containing drinks. Good choices are sports drinks such as Gatorade or prepared replacement solutions such as Pedialyte. If someone shows signs of heat exposure or has an elevated temperature, try to cool the person down in the following ways. Remove any excess clothing and loosen other clothing. Air-conditioned areas are best for helping return the affected individual's body temperature to normal and break the heat exposure cycle. If air condition is not available, increase cooling by evaporation by placing the person near fans or in the shade, if outside. Place a wet towel around the person. And lastly, avoid exposing skin to excessive cold such as ice packs or ice water. This can cause the blood vessels in the skin to constrict and will decrease, rather than increase heat loss. Exposure to excessive cold can also cause shivering, which will increase body temperature. This may cause the dehydration symptoms to become worse. Treatment in the emergency department centers. first on restoring blood or fluid volume and electrolytes, and treating any life-threatening symptoms while also trying to determine the underlying causes of the dehydration. If the affected individual's core body temperature is greater than 104 degrees Fahrenheit or 40 degrees Celsius, doctors will cool the entire body. They may promote cooling by evaporation with mist and fans or cooling blankets and baths. If there is no nausea and vomiting, fluid replacement may begin orally for some patients with moderate dehydration. Patients are asked to drink electrolyte or carbohydrate-containing fluids along with water. However, if there are signs of moderate to severe dehydration, such as an elevated resting heart rate and low blood pressure, fluids are generally given through an IV. If a fever is caused by dehydration, the use of acetaminophen, for example Tylenol, or ibuprofen, for example Advil, may be used. This can be given by mouth if the patient is not vomiting, or as a rectal suppository if the patient cannot take anything by mouth. Intravenous or IV fluids and IV medication, including some that contain electrolytes or medications that help normalize electrolyte levels, are often used. Other IV medications may need to be used to treat underlying causes of dehydration. For example, IV antibiotics for dehydration caused by infection. Anticipation of the need for increased fluid intake is a key to prevent dehydration. Plan ahead and take extra sports drinks that contain electrolytes and water bottles to all outdoor events and work areas where increased sweating, activity, and heat stress will likely increase a person's fluid loss. Encourage athletes and outdoor workers to replace fluids at a rate that equals the loss. Avoid exercise and exposure during high heat index days or high air temperature with high humidity. Listen to weather forecasts for high heat stress days and plan events that must occur outside during times when temperatures are cooler, usually in the early morning and after sunset. Ensure that older people and infants and children have adequate drinking water and fluids containing electrolytes available, and assist them as necessary. Provide any incapacitated or impaired individuals with adequate fluids and encourage them to drink. Avoid alcohol consumption, especially when it is very hot, because alcohol increases water loss and impairs a person's ability to sense early signs associated with dehydration. People should wear light-colored and loose-fitting clothing if they must be outdoors when it is hot outside. Carry a personal fan or mister to cool the body so less fluid is lost through sweating. And lastly, limit the time a person is exposed to hot temperatures. Find air-conditioned or shady areas and allow the body to cool between exposures. Taking someone into a cold area for even a couple of hours each day will help prevent the cumulative effects of high heat pressure. Thus, don't forget your water because dehydration can be prevented by staying well hydrated. That is all. Thank you.